Okay, I'm going to start because it's 10:01 already. Good morning, everybody. So, welcome to your virtual work experience in radiography. This will be covering diagnostic radiography. So, my name is Sarah Eads, and I've been a radiographer now for 24 years. I've spent the last 18 of those working at Birmingham Women's and Children's Hospital. At the end of this session, there's a chance for you to ask questions. There might be people still joining as we go along, but hopefully Yassir is online and he'll be just letting people in, so you might hear a few noises. So what I'm going to be talking about today, so the key objectives are to explain what a radiographer is, the role and the opportunities as you develop your career in this profession, what we can offer at Birmingham Women's and Children's Hospital. I'm going to look at patient pathways and how imaging fits in, because I don't think people quite often understand just how important a diagnostic radiographer is. Then I have some input from various radiographers in our department about why they chose to be a radiographer and why they love working for Birmingham Women's and Children's Hospital and what things that we can offer there. So, what is a radiographer? So, a radiographer primarily begins their training learning to take images by X-ray. So, the course is a 3-year undergraduate program where you combine theoretical knowledge with practical training. Birmingham Women's and Children's Hospital is a placement site for Birmingham City University, although we do take elective students from elsewhere. On our placement, to be a radiographer, you will study physics of imaging, patient care, anatomy and physiology, and this will be the same at any university you choose to go to. On placement, the radiographers also assess your clinical skills as a whole. So we'll assess things like how you talk to patients, how you talk to other members of staff, how you answer the telephone. And then we also do assessments of your performance of examinations. So you'll have a logbook to complete of numbers of examinations. And then when you've completed so many, you'll take some of these as assessments. And the radiographers in department will assess you on your clinical practice. Whilst you're training to be a radiographer, you will be supervised at all times. So a little bit about X-rays. So I guess most of you are doing some kind of physics and understand a little bit about X-rays and how they work. So this isn't going to go into massive graphic details about X-rays, but I'm just going to explain a little bit. So X-rays are energy that's radiated or transmitted in the forms of rays or waves or particles, and they're only present at the time of exposure. So we make an X-ray, so it's a man-made form of radiation. They don't remain in the air and they travel in straight lines, and they sit on the light spectrum just above ultraviolet light and just below gamma rays, which are a different kind of radiation that's used in radiotherapy. So there are lots of other modalities as well. When you qualify, though, as a diagnostic radiographer, you will be proficient in taking plain film X-rays, a CT image of a head, and fluoroscopy, which is moving X-rays. You'll also be proficient in taking portable images and theatre examinations, but you will also have an understanding of other imaging modalities such as ultrasound, CT, MRI, nuclear medicine, and DEXA scanning. Most first posts are in general imaging department, where you will work as a preceptor for a year. So once you've done your training and you're qualified, you then have a year where you work as a preceptor. This means you get supported during this time to develop your skills. You'll normally get opportunities during this year as well to look at various other modalities around your department and looking at different areas for role development. I'm going to run through a little bit about a patient's pathway, just so you can imagine how important it is and how vital we are to the service of the hospital. So a patient will come in, they've fallen, they've tripped, and they've fallen into an oncoming vehicle. Next thing that happens is an ambulance arrives to the emergency department. They will perform their ABC, so check for airway, breathing, circulation of the patient. The first time the radiographer appears and starts, we'll be doing a plain film x-ray, generally of the chest and neck, occasionally also including the pelvis. So the patient's Glasgow Coma Scale begins to fall. So the next examination that will happen will be a rush to CT, and they'll be doing a CT of the head. So again, the radiographer is involved in doing that CT. So a patient then will be admitted to ITU for observations. Whilst they're in ITU, they realise that the patient sustained a femoral fracture. So this is from taking a plain film. So the radiographer will have taken a plain film of probably their chest to check for lines and positions. So if the patient's intubated, to check it's in the right place. They've got a line running through, running blood products to check that. And then for any other imaging, sort of to have a look to see if anything else is going on. So they found a femoral fracture. Next thing, the patient needs to go to theatre, and that needs to be fixed. So a radiographer again is needed to go to theatre, and they use an image intensifier in theatre. So this is a different form of x-ray. So these ones are moving x-rays. So we can have a look as metalwork is put into a leg, for example. Patient comes back to ITU, oh, their tummy is looking a bit distended. So the next thing will be another kind of radiographer, so an ultrasonographer radiographer will come up and have a look for free fluid. So they'll be doing an ultrasound scan. The list could go on. A patient during hospital could have a multiple types of imaging or just a single. We may, for example, they might need more looking at in their head, so they might have an MRI scan to look at different things. Or there might be a blockage in their abdomen, so they might need a fluoroscopy examination where they swallow contrast and we have a look. So almost all patients that get admitted to hospital have some types of imaging. So when we're watching all these TV shows and they're talking just about doctors and nurses, it's important to realise that actually radiographers are just as important, and none of the things that happen to these patients could happen without us as well. Okay, so I think I need to send this. Let me have a look. So, yes, Siri, are you able to play the video, please?
Yeah, I'll do that there.
So I've done a little video just to have a look at our department. So if you were coming for work experience, normally in the traditional way, you would come and look around the department and we could show you the rooms. So we've done a little video just to show you a little bit about what it looks like at Birmingham Women's and Children's Hospital. So this is our corridors as you come along. In front of you, you can see this is the desk where you would book into reception. At the moment, obviously, we've got all these nice arrows on the floor to maintain social distancing. On your left is our CT scanner. We have two in the Children's Hospital. This is our viewing area. The radiographers are based here, and the coordinator for the day looks to see what x-rays need doing. So we come out, CT's opposite us, linen cupboards. You go along the corridor here, and this is the general waiting area. We have a dental x-ray on the right. So we take images of the teeth here, the mandible and the jaw. Intraoral, where we put the film inside the mouth, and then the special machine that goes around your head as well. So taking pictures, which you can also have done sometimes in the dentist. So then if you have a look through into this x-ray room, this is where we do plain films. Generally inpatients are performed in this side of the hospital. We've got another emergency x-ray room across the other side. We have a combination in our department. So we do a little bit of DR, which is digital radiography, where the image appears directly on the screen, and some CR where it has to go through a processor. As you come along, here's another x-ray room. This x-ray room is digital room, and it also does fluoroscopy, which is moving x-rays. And it can do things like looking at leg length, so the entire length of a leg's all in one picture. Got nuclear medicine just down the corridor. I think that's the video done. So our department's nice and bright. It's got lots of pictures on the walls. We made it as friendly as possible. We regularly get it updated. Lots of different artwork and things and different themes. Obviously, during normal times, we also have lots of Christmas decorations and things come to the Children's Hospital. So I'll just go through and find the next page where I'm at. So I wanted to share some thoughts of some of the radiographers who work. Oh, sorry, you see, I need to play this bit as well. Some thoughts of why the radiographers want to be a radiographer and what made us choose the career as well. I don't know. Can you play that bit, Yazir?
No, I don't have that video clip.
So I'm just going to talk to you then about why we picked radiography. So I've got this up here. So I asked all the radiographers in our department, and a few got back to me and just told me why they picked to be a radiographer. So I wanted to do something that made a difference. I wanted a role that's going to change, develop, and keep me interested. Mel said, I came into radiography by accident. I was going to university to do history and sociology, and then I went for a year in the States, and I looked and I found the job was really practical and had a technical element to it. Mel, I chose to study radiography after it was suggested as an option as my guidance teacher. I spent a day shadowing radiographers in a local hospital, and I just saw how varied it could be. Charlotte said, I always knew in my heart I wanted to work in a profession that helps others. One of my siblings was diagnosed with cerebral palsy at a young age, along with my auntie, who sadly passed on. I became a care assistant to help me get through college. And as much as I enjoyed it, I realised nursing wasn't for me. At the time, I didn't even know about radiography. It wasn't until a friend shared about it. And I thought, oh, okay, I'll do the same. And I thoroughly enjoyed my day there. It was the best decision I've ever made. Lorraine spoke to me. She's our ultrasound lead, and she said, I stumbled into radiography many years ago. At the time, the profession was completely different. It's now expanded enormously, and there are multiple career pathways and opportunities to progress, including ultrasound, cross-sectional imaging, CT, MR, interventional radiology, cardiac and fluoroscopy, and emergency radiography. Radiographers can now progress into advanced practice where they are autonomous practitioners. That means that you get to make decisions yourself, you get to decide the progress of a patient. So you can be an advanced practitioner in all sorts of different ways. For example, you can report in emergency medicine or ultrasound and some CT experiences. You can learn how to put lines into a patient yourself, so put a femoral line in by yourself. You can put drains in as well. The development in stents in interventional radiography means that radiographers can support life-saving procedures that previously were inoperable or required major surgery, and gives enormous job satisfaction. It's really hard work, but you're constantly learning and adapting, so it's never boring. A qualified radiographer has the opportunity to work not just in the United Kingdom, but all across the world, as training in the UK is recognised as first class. Rachel said, I always knew I wanted to be a job where I was helping in people in their life somehow, and radiography just seemed the perfect fit for me. I've also got some information about why these radiographers chose to come and work at Birmingham Children's Hospital. So I'm just going to get these up because obviously I couldn't memorise all of them. So I came to work at Birmingham Women's and Children's because I wanted to work with children. Birmingham Children's Hospital is the first women's and children's standalone trust. I love working with families, especially helping in child protection cases. I feel like I'm making a difference in the world to a vulnerable person. Mel said to me, the people at BCH keep me here. I like to think I'm making a difference in children's lives and their families, even if that's only for 5 minutes when I'm with them. I'm also dedicated to the idea of improving the working environment and the department for all and future generations. BCH staff always keep the patient at the heart of everything we do. As Charlotte told me, throughout my training, I knew I would much rather be imaging children. I get such a rush when I got a good image, and I still do. When the job opened up, I applied straight away. I knew this was what I meant to be doing. 8 months on and I'm going strong, and I wouldn't change a thing. This has truly been the best experience of my life, and I would urge anyone who feels even a slight passion in helping others to consider radiography. Lorraine said to me, working at BWC gives me the unique opportunity to work in a centre of excellence, experience complex referrals that are not seen elsewhere in the UK. For example, liver transplants in children where they divide an adult graft liver in two, enabling two recipients to receive a liver from a single donor. Complex cardiac anomalies from fetal diagnosis, so that's when we diagnose at the Women's Hospital, during an obstetric ultrasound, through to the diagnostic radiography examinations and corrective cardiac surgery after a child is born. So some of these procedures are done in the X-ray suite, so we can put stents in, we can put balloons in. So major pediatric trauma, of which radiography is integral to patient diagnosis and survival. I feel like that I'm in the same profession after 32 years and still enjoying it is a testament to why radiography is such a good career. I think that's a really lovely note to end on. We tried to put an extra picture and apologise for this. And that's the end. Have I got any questions? Is there anything I can answer about radiography as a career? Just going to have a look in your chat box. Okay, so the benefits of doing a master's afterwards, obviously for career progression. So some posts insist on a master's after you finished your degree. I personally know probably about 3 people, maybe 2 people in our department who've done a master's. It really helps you get a bigger depth into a particular subject. So ultrasound is generally a master's afterwards. Are there any routes into radiography from medicine? Yes, you could go study radiography afterwards, but it would still be a 3-year degree. So medicine obviously is completely different from radiography, different technical aspects. So yes, you could do it, but you'd still need to do 3 years. So a radiographer is involved in splitting a liver. So when someone passes away sadly, or and they decide to donate organs, what happens is that they get onto there's a waiting list, and if a child receives that liver and is on the waiting list to receive that liver, the liver can be split into 2. And then that liver can then be given to 2 people. So an adult liver can be split. You can also do live donations for liver as well, because it's one organ in your body that regenerates. However, obviously, when you're splitting a liver, it means the patient, the donor, has passed away, sadly, and then that liver can be split and given to 2 recipients. If you did applied science, would you require an IO level? So I'm not sure about which universities require what. You would need to look at your prospectuses for that. I did, to get in, I did 2 A levels and 1 AS level when I studied, but obviously we're talking many years ago. So cardiac radiology. I do cardiac radiology. I've worked in cardiac cath lab suites and also general. Obviously we do chest x-rays to look at cardiac diagnosis. You can do echoes to look at the heart as well, which is a cardiac ultrasound. And then cardiac cath lab. When I first started doing cardiac cath lab, it was mainly diagnostics. So we would inject contrast through arteries and veins and have a look at the heart. Now a lot of our work is supporting a cardiologist, so is a cardiac doctor who's specialised in dealing with radiation procedures, and they will insert stents and other devices to block holes in the heart or make vessels bigger. Is the course more physics, biology or chemistry? The course is a little bit of combination of all. As far as learning about radiation, that's physics. You need to know your anatomy, so that's your biology side of things, and physiology. Chemistry wise, I know a little bit, we learn a little bit about contrast media and that kind of thing, probably least chemistry, physics and biology more. Patient contact, so it depends on the course that you do. My course, you did 70% was university in your first year, 30% was practical, and then the next year it was 50-50, and then the last year it was the other way around, so it was 70% practical. At BCU, I believe the course is sort of divided up into weeks and you do different blocks. How do you treat fetuses using x-rays? We don't treat fetuses using x-rays at all. We don't x-ray a fetus. We do ultrasounds of fetuses while they're growing. So the scans that probably most of you had when you were inside your mum's tums. What's the salary for cardiac radiology? Okay, so each radiographer is salaried on a band. When you qualify, you become a band 5. I can probably look it up what the salary is for a newly qualified radiographer. Let me have a look. It's we're on a pay band the same as all health salary AHPs. You can probably Google this if you have a look at salary for AHPs. I'll just have a look and see what the starting salary is. So a band 5 radiographer. Have a look. I'm just reading the rest. Is BCU the best university to study? It's the only university in Birmingham to study diagnostic radiography. Right, let's have a look. So band 5 radiographers that's a band 7. I'm just having a look to see if I can find them on here. Gosh, let's have a look at a band 5 radiographer. I have to do a search. They are quite, you can find the salaries all online. There's no kind of secret to what we earn. So band 5 radiographers between just under 25,000 to 30,000. Is Birmingham the best university to study? Birmingham's one of the universities in the country. I think there's about 28 universities, and they're all pretty much as good as each other, I would say. I don't think there's like a rating of which university to go to. Anybody got any other questions? How long does it take to go from one band to another? So when you qualify as a radiographer, you go get a job, and it really depends on your trust. Generally, and your career progression. So as soon as you work, you can stay as a band 5 radiographer forever if you wanted to. Otherwise, you can work your way up and choose a speciality to move into. I have known radiographers go from band 5 to band 6 in a year. Other radiographers have chosen to focus on developing their skills a little bit longer. When you qualify, do you do a range of different scans? Right. So when you qualify from university, you can take plain film x-rays and a CT head. That's what you're qualified to do. When you go to your first trust, they then add other skills to you. So you get a year as a preceptor, and they will let you have a look at all the other areas, and then you can specialise, or you can develop those skills to become a senior general practitioner in radiography. My favourite thing, oh, I love so much about radiography. I love working with the patients. I love our children at the Children's Hospital. One of the things I'm most passionate about is supporting, the radiologists improving or disproving child abuse. So I work a lot in performing non-accidental imaging surveys. Yeah, so what happens is that as you come to your third year, um, you can apply for jobs. So we've got 2 jobs out at the moment, and a couple of our students have applied for them in their third year. They may or may not be successful. If they are successful, what happens is that job kind of stays put for them until they qualify, because we feel that they are the best person for the job, and we would keep that post for them for when they qualify. But they have to go through an interview panel, and they have to prove themselves as being the best. I think what you might be thinking about, though, is apprenticeships. And Radiography Apprenticeships is actually something I'm going into a meeting to discuss in a few minutes. That is a different way of getting into radiography. At the moment, we haven't got any apprenticeship posts at our hospital, but it is something that hopefully in the next 12 months will be set up. So what you do then is you apply for a helper job. And while you're working as a helper, you also train. It's a new course. It hasn't been out very long. At the moment, there are only the school in Exeter you can study at. However, that is growing. How can we sell ourselves to be hired? Do you mean hired to do the course, or hired as in after you've qualified? So if you want to get onto the course, you need to A, have attended something like this, B, really have looked into what you want to do after you've been qualified. That'll be something that you'll be supported while you're training. So what they do is you have a BCU, they have something called Formative and Summative assessments, and it's a bit like an interview. You have to pass it to carry on, but it shows that you're competent and you've developed enough confidence and competency to be qualified. A radiologist is a completely different job. So that's a doctor that studied medicine and then has moved into a profession as a radiologist. If you mean what skills are vital in order to become a radiographer, do you think people get hired more? I'm sorry, I don't understand that question. You can only be a radiographer if you've passed your degree. Oh, right. Okay. So what skills to be a radiographer? You need to be able to adapt. Since I've been a radiographer, we've gone through so many changes. So originally we used to use film to take x-rays. Now we use computer systems. Radiography is one of the fastest moving professions out there. Advanced practice has come along as well. Radiographers now like the world's your oyster. So my current role, I'm actually clinical governance and quality lead. So that means that I look at all the datexes, so that's incidents that have happened, and look for themes and where we need training and development. I'm also our student lead, so I work with our students quite closely. I provide like welfare for them and that kind of thing. So what skills? You need to be patient. You need to care about your patients. You need to have be ready to change and develop. Also have some physics and biology behind you. Do you think people get when they get work experience? Yes. So work experience is vital to get onto the course. It was compulsory up until last year. We took it off last year, but what happened was from obviously because of COVID, we can't come into the hospital to do work experience. So we've had this virtual day instead. If you came to the Children's Hospital to do work experience, what I set you up to do is spend a little bit of time in each area just observing. So first of all, you would come to our reception desk, have a look at coming into the department and how request cards are booked in. Then you'd come into the general team, have a look at watching how an x-ray is performed, having a chat with the radiographers about why they did radiography. So that's why I put that part into this talk. Then you would go to the CT MRI department, watch a CT, watch an MRI. We then let you have a look in nuclear medicine, which is where we inject radioactive substances into a patient, and then we use a detector to record where they go. Then you'd come back to the general, we'd have a little bit of a chat about the course, you could ask questions, and then you get a certificate, and we get you to give some feedback. So that would be what would happen if you came. At the moment, all work experience is stopped. Yasir might be able to answer that a little bit more as to when we think it might happen again. The most interesting thing I've done as a part of my job, I would say that the child protection cases that I've been involved in, I find really interesting. So we x-ray children that have been suspected physically abused. How do you deal with pregnant patients because radiation is dangerous? Okay, so for every single x-ray we do, there has to be a risk benefit. So I used to work at the Women's Hospital in Liverpool, and obviously most of our patients are pregnant. Sometimes they would come in and they would need x-rays. So the benefit to them is more important than the slight risk to the fetus. So we only x-ray if there is no other way when someone is pregnant. So we always ask if we're x-raying anywhere near where the baby is. So if you were out, you were pregnant and you broke your femur, you would need an x-ray. The risk of not x-raying your leg is more vital than the small amount of radiation the fetus would receive. Obviously, radiation is a lot lower than it used to be in years gone by. So we've got much better at taking radiation and transforming it into an image by keeping our doses lower, if that makes sense. Any more questions? Yes, do you have any information about whether in-person work experience will be happening?
We don't at the moment. We don't suspect there'll be any at all this academic year. It might be reviewed for the August, September, but up until at least then, there won't be any placements.
Okay, so this kind of work experience is obviously the best way that we can show you a little bit about what we can do and answer questions for you. If there's no more questions. Yeah, it's possible to specialise in neonatal radiography, but you'd have to go to a hospital that specialises in neonatal radiography. So Birmingham Women's Hospital, Liverpool Women's Hospital, you would specialise in neonatal radiography there. The Children's Hospital, we work with children all the way from 0 up. We wouldn't get to pick which patients we x-ray. So it depends on which hospital you work at. Okay, so radiographers themselves are really protective. I don't get radiation because I don't stand in the primary beam. I get a small amount of scatter, but that scatter is probably equivalent to someone who spends all day sunbathing, to be honest. It's really low. I wear a radiation badge. I've never received a dose on my badge that has been higher than normal background radiation. So there are no studies that I've ever read to say that a radiographer has an increased chance of getting cancer. Yeah, there isn't anything out there. Nobody's ever done any research to say that we do. Yeah, so. Is that all? Thank you ever so much for all attending. I really appreciate it.